What if your kids' tantrums, meltdowns, big emotional reactions weren't just behavioral, but there was biological reasons why they are happening? Hi, I'm Dr. Roseann. I really have been teaching people for 3 decades on how to regulate their nervous system using only science backed natural solutions because we need as much regulation as possible. And self regulation is the key to lifelong mental health. And kids aren't just born that way, they develop over time, and it's skills that we can teach our kids. And I really believe in empowering parents. So let's talk about the medical mystery behind your child's OCD, anxiety, PANDAS, depression. What is really going on? And there's so much discussion in the world right now about underlying reasons, triggers, sources behind what causes a lot of issues, clinical diagnoses, neurodivergent brains. There are a lot of reasons why kids are wired uniquely today. And, what we're really going to focus on now is that these kids with huge emotions, big levels of emotional dysregulation, because it is something everybody's talking about. And, kids of all ages, all backgrounds, all types of differences will dysregulate. And some kids dysregulate more than others. And as I always say, when there's intensity, there's a high frequency, or it occurs for a long time, those behaviors that occur at that level, there's a clinical problem. We need to pay attention to that. We can't just deny it, right? And I'm not saying people do that, but sometimes we're like, what's going on here? What are some of these medical reasons that could be driving your kids' behavior? Because when we have cases, particularly with kids that are typical before we have an onset of like rage or OCD or phobias, aggression or self harm, refusal to go to school. These are things that are becoming increasingly common, regardless of what your clinical diagnosis is, or maybe you don't have them. Whenever we have something that turns on quickly or ramps up, so you have a pre existing condition, some level of anxiety, or maybe you have ADHD, but then there's just a real increase. You really have to look at some of these possibilities because there could be a medical reason. And, for 3 decades, I have been supporting people, again, using just clinically proven, science backed solutions that regulate the nervous system. And they're mostly holistic, even though we don't talk enough about it. And one of the biggest reasons people come to me is because sudden changes in their kids' behavior, or that they've tried a lot and things haven't worked, right? And I have this trademark brain behavior reset program, and people come and get a brain map, and I'll talk about that. If you are interested in working with me, you can go to drroseann.com/help. It's our solution matcher. And I want you to really think of it as just a quick 3-minute assessment that gives you my personalized way of doing things to guide you in the right direction. Because as a mom of two uniquely wired kids, and getting support for different reasons, I'm actually in shock how bad things still are in 2025, and I want to prevent that, and that's what that's about. Let's talk about the clues of issues, right? So we can have signs of over and understimulated nervous system. So yes, we're talking about the overstimulation, the sympathetic dominant, right? So your nervous system is jacked up. Fight, flight, freeze. Sometimes we have fawn in there. And so you can see aggression, you can see hole punches, you can see lots of cussing, you can see full shutdown and avoidance with aggressive talk or aggression in it. And on the other side, we have the understimulated behaviors, and they can be as tough to deal with. Full shutdowns, not getting up, sleeping 20 hours. I've worked with kids that have slept between 20 and 22 hours a day and don't have a proper diagnosis. And we'll talk about that. I was just on with an awesome kid who, might freak people out in the sense that this is somebody that had to leave college due to depression, but is just coming out of it so beautifully because in our brain behavior reset program, we rewire the brain, right? Using tools like neurofeedback, PEMF, other things, exercises, nutrition, all that other stuff. But we work on behavior and he just embraced it. And it's just a joy to talk to somebody who has such dramatic change, had a 49% brain change. Really, what was changing is how he felt about himself. And I just love that. The ripple effect that gets to have, not just for him now, but in his future and the people he comes in contact with and potentially has kids. Let's talk about potential reasons for some of these big overstimulated behaviors, understimulated behaviors, and when kids are really showing extremes, right? Now, these can be, just so you know, you don't have to have extremes to be these sources because, 50% of the time somebody comes to me with ADHD and they don't have ADHD. And I see a huge amount of people with the first thing, right? That could it be that what you're seeing is PANS and PANDAS, right? So in PANS and PANDAS, what happens is a misdirected immune response. The body, an infection or toxin sets off this response where the body starts attacking itself that produces a lot of neuroinflammation, also can produce just systemic inflammation. All of these neurological, neuropsychiatric symptoms can pop up. And it can be from things like strep, any tick-borne illness. I can't believe the level of misinformation about ticks as this is May of 2025 and this is, Lyme disease month. Please know the number one way to prevent Lyme disease is prevention. And the number one thing you can do is actually taking a shower immediately, not later, immediately after coming in. There are many other things, mycoplasma, COVID, you name it. The flu can set off this chain reaction. Why? We don't know all the answers, but we know that there's a higher level of genetic variance that people have. And I'm a PANS mom. And so, we have a genetic variant called MTHFR. We don't detoxify properly. So those toxins just didn't get out of my child's system, right? And he had compounded levels of different things from strep to 9 tick-borne infections. So there's a lot of reasons why it can occur, but in PANS, there has to be a dramatic onset, right? So people will say things like, wow, they seem possessed or completely different overnight. And again, most of my people, at least 50%, have already had some level before, right? Like a low level of anxiety or maybe a learning disability or maybe they already were autistic or there's often other things that can be confusing. I find this to be one of the biggest reasons people don't get proper diagnosis. And I do all these videos and so many people learn about PANS from the first time from me. It is unfortunately not commonly known and understood, and it is widely accepted, but the people who are boots on the ground, particularly pediatricians, mental health providers, they might not just have the training and understanding. There is no medical test to diagnose it. There are tests to diagnose the underlying infections and toxins, but there's not a single lab test that says, oh, yes, you have PANS. It's a clinical diagnosis, the same as Lyme disease. So what happens is that can create these behaviors that come on suddenly, again, or it can be a dramatic worsening, right? Now, you always want to think when you have dramatic worsening or sudden behaviors, is something going on? Was there a traumatic event? Is there some kind of horrible thing going on in school? One of my best friends kind of had told me something was going on with her very high level kid, but had, as we call in the world of trauma, there's big T's and little T's, right? So your big T's are things we always think of, like you witnessed a murder, somebody assaulted you, physical or sexual abuse, right? But there's a lot of little T's, especially when your kid is having a hard time, right? Maybe it's a bullying episode, maybe it's and that could be a big or a little T, right? My friend's son had a series of little T's, and of course, what happened? He's depressed. I helped her to unpack, and she's like, I only know any of this stuff from you, Dr. Rowe. Like nobody's talking about it. So we're making an action plan to get him out of it. She's in California. I helped her to understand why the talk therapy wasn't working. So we got to really think about what's going on, why things aren't working. So another big reason behind your kids big behaviors, right? Those big reactions, tantrums, shutdown can just be neuroinflammation and autoimmune. In the same way that infections and toxins can create this dramatic onset and lead to PANS and PANDAS, it also can cause more of what we call autoimmune encephalopathy, where you're still having that effect, but it's not a dramatic onset. There are many other reasons for neuroinflammation, from food allergies, celiac, other neurodivergent conditions are associated with neuroinflammation, including autism. It can be a gut brain connection. There are so many reasons for that. And I'm so adept at dealing with these things because, again, everybody comes to me because they're typically treatment failures is the number one reason. But then I have this cool group of people who are like, hey, I'm already holistic. I want to go down this route. I want to go to the leader. That's me. Another reason is toxic load and mitochondrial dysfunction. So our cells are important. And we know that, but yet we're not aware of so many of the clinical issues that actually affect our cellular health. And I don't even just mean that about kids, I mean for adults, but things like hypermobility, hyperflexibility, autism, these are clinical conditions that where you have mitochondrial dysfunction, where the cells have to work really hard. And when your cells have to work really hard, I have a kid who has hypotonia, and hypermobility. So you're like, yeah, so does my kid. What's the big deal? Well, it is a big deal. So when my JC has to engage his muscle, he needs 2 times the amount of energy to do that. That means he's more, you're often kids that are like this are either wired or tired. They can appear ADHD. They can appear on both ends, hyper. They can appear really unfocused. So he need a certain way of managing his health. He gets mitochondrial support, like many of the people do in my program, has to eat a certain way, has to actually eat a super high protein diet, can affect everything from your eyes to your bowels to your brain. And guess what? There's lots of things you can do to support, right? Because we need cellular energy. When you have low cellular energy, you can have those big reactions, right? The shutting down, I'm so tired, or the extreme of hyperactivity. So, these are some of those reasons behind that. So, a big thing that I don't feel that we talk enough about, but I did a great episode with Dr. Tony Ebel about it. It's birth trauma and brain injury. I can't tell you how many times I do a brain map and we see clear evidence of birth trauma or brain injury. It's causing the problems. I recently had an adult who had very, very late in life onset of seizures. And I said, did you have a head injury? Like within that year? And she was like, yeah. And somehow nobody connected the dots. The neurologist didn't connect the dots. I'm seeing her 20 years after that. Guess what? It shouldn't be that hard to connect that dots because the seizures are there. And I'm not convinced they have to be there. And there are remedies and things that you can do. But when you have, for example, birth trauma, and just know that not everybody has a head injury or the degree of how these things impact us is very, very unique to each person, depending on their assets, their strengths within their body, their temperament, their lifestyle. There's so many factors that can be helpers or herders or, draggers or lifters. And, that's part of what I do and help people figuring that out. When you have birth trauma, right, you can have actual physical injury. I'm going to use scary words, brain injury, right? Damage to the brain. These are all things that you can change the brain, right? I do it all the time with neurofeedback and the different components of our program and PEMF and all that. But it can disrupt communication, how the circuits are working, particularly, brain communication is very important. Great examples of people with impaired brain communication, classic, somebody with a learning disability. What do you expect to see in their brain, right? When I do these brain maps, you see low brain communication. Somebody with ADHD might have low or they might have over communication. You can show up as what we see as clinical diagnoses. You get put in a bucket, but what really could be is these brain injuries, falls, slips, sports injuries, birth traumas, just to dispel any mystery or, I should say, false information about head injuries is that you don't have to be knocked out, seeing stars, bleeding. You don't have to have a diagnosis of a concussion to actually have a concussion. The more head injuries you have, the more likely you are to have things that are affecting you. And it really can be, changes that you can see after head injury. Obviously, birth trauma, you're not going to know, but you might, right? Most of my birth trauma kids were, I had one of my first cases of a very severe birth trauma where the child was diagnosed with autism. Later lost that diagnosis after doing neurofeedback. Was he actually broke his clavicle at birth, and he just couldn't tolerate things. And on the brain map, I could see that he had a brain injury, which was later verified by nuclear testing, right? Doing I believe I think he did a CAT scan. I think he did an MRI. We were able to do things to support him. He graduated in the top 10 of his class and got into one of the most prestigious engineering colleges. Always smart, but just was in a sensory overload. So you can have sensory issues, you can have tantrums, you can have sleep problems, you can have aggression. What do they sound like? Could look like autism, could be a mood disorder, could be oppositional defiant. Remember, these diagnoses are often just done without really checking under the hood, and they're done with checklists, and they say, here's what the behavior looks like. What I do is something different. It's called the QEEG brain map. It's a non-invasive way to see how is the brain functioning, what's overworking, what's underworking. And based on those brain patterns, you really can see what clinical issues are there. And again, if we don't even want to talk about diagnosis, it really helps us to say, this is what this kid can do well or adult. This is what is harder and why. And then we use that information, or I do, because I'm, 30 years as a mental health provider, I'm able to connect it to behavior and put in those interventions in a way that, is only based on, working with over, thousands of kids, right? You have to take a common sense approach to mental health, and that's just not what we do. The brain maps are really just an unbelievable diagnostic tool. Recently, I'm working with a set of parents who have different viewpoints on what their child's treatment is. So one of the parent was like, let's get objective. Let's get an objective look on this so that we can come up with a better treatment plan. I don't even think they're going to work with me. I think they just need guidance on what the best path is, because they realize they're just at such discord over this. For so many of my parents, right? They understand why their child is acting this way. This family that I saw, the college kid, I'd worked with a sibling a dozen years before in a very different capacity. So when they were getting stuck and stuck and stuck, they were like, we're going to Dr. Rowe, because they're both sciencey people, and they're like, that's where the science is going to tell, the therapy's not working, these things aren't working, all the traditional things weren't working. They didn't want to do medication. Nobody did, including the young person. They really got to understand what was happening. And today was just really exciting, because I just am so proud of when a young adult takes ownership over their own wellness. And I got to hear that, and I've been witnessing it. And you can kind of tell when people make a shift in what they're doing, and that it's going to really be there. So many people get the wrong diagnosis. And when you get that wrong diagnosis, you're just not able to get to where you're supposed to go. We don't talk about these underlying reasons behind some of these big clinical diagnoses and big behaviors, right? And when you start thinking about, what about infections? What about toxins? You start wondering, where could this have come from? Well, they're everywhere. I'm going to a retreat in a couple weeks in Colorado, and the guy said, well, it's in Breckenridge, there's no ticks out there. And I was like, I know there are, because I have a client right there, and they're everywhere. They even found ticks now in Antarctica for the first time. So there isn't a place that doesn't have COVID, mycoplasma pneumonia, or strep and ticks. There isn't a continent anymore. Are there places like that have, like, where I live in Connecticut right now? If I went outside, within 5 minutes, I would have ticks crawling on me just on the grass. How am I addressing that? Right? How am I going to make sure that I'm not getting bitten by a tick? We don't always connect some of these things. And so the mental health breakdown, the brain gets affected by these medical things. And so where do they end up? I mean, I know people personally who everybody knows it's medical. Everybody, car accident, fall. We know there's Lyme disease, and yet they end up in front of people like me. They go, well, it's mental health now. And yes, I'm a nervous system regulator, and the power of regulating your nervous system, you can't even put into words what it can do for you because nothing else in the body is going to work properly until you regulate the nervous system. That's why I get the results that I get. But we have to stop thinking, oh, it's ADD. Oh, it's OCD. Those are behaviors that reflect that. And so when we use tools like a brain map, we're really able to get underneath there. And even without a brain map, if you suspect that your child, oh, shoot, they had Lyme disease, and then 6 months later, they have OCD, find somebody, a functional doctor who's really going to get to the bottom of that and help you guide you in where you are. Healing is possible for everything when we stop chasing symptoms and look for root causes. We talk about root causes, sort of, but we're not really getting there. And I really thought we'd be further along in these 3 decades of me doing this work. I know we're moving along, but I want to empower parents that just because your kid has a diagnosis, if your kid is struggling, please don't accept that. Please don't let a provider say, well, that's just the way it works. You put them on the bipolar meds and it's the best it's going to be. Bologna and cheese. You have not met a provider who is going to do the deeper work. There are people like me out there in the world. I just started doing this, in 1992. If you're interested in learning more and you really want to find the right solution, that's what our solution matcher is for. It's the only way to get access to potentially working with me. And you can go to drroseann.com/help. And that's going to be that personalized quiz, that guidance that's really going to help to get you in the right path. As always, no matter where you are in your journey is where you need to be, but please have hope. And hope and prayer are one part, but action is the other. And I hope you take action by taking the solution matcher.